Today's webinar is Understanding and Supporting Persons with Dementia. Dr. Neerja Singh has 10 years of experience in counseling and diagnosing various mental disorders. She has worked with Rahafal School for Special Children, Maths Hospital, CGM School as a psychologist, and given psychotherapy to children with ADHD and home based programs to parents of children with special needs. Besides, she has worked at City Heart Center and provided counseling to adolescents with drug related problems, alcohol abuse, ADHD, and marriage counseling as well. She has specialized in dementia and has worked closely with patients with Alzheimer's and other related problems. She has given lectures in various schools, colleges in Uttarakhand, such as CGM, Graphic Era, IMA, Manav Bharti, etc. In the pandemic, she has given lectures on major mental health problems on World Mental Health Day. She has taught psychology and philosophy in UPES from 2010 to 2012 to the BA LLB students. At present, she is a lecturer at Doon University and is teaching students of BA and MA Introduction to Psychology, Community Psychology, Neuropsychology, Organizational Behavior, Psychopathology, and Cognitive Psychology. She is also an editor to a journal in Bareilly, Uttar Pradesh, counselor to the ONGC Polytechnic Institute. She has also written a paper on social support and resilience in care providers of persons with dementia. Now I'm handing the mic to you, ma'am. Kindly begin your lecture.
Thank you so much, Shalini. Pranam, sir. Thank you so much, Shalini. Dr. Satish, sir, I am honored to be a part of your program today. We collided into one another in an online presentation on visual disabilities. From there, I just said hello to sir and I gave my brief introduction. And ever since then, he has been so enthusiastic about knowing about dementia that I felt I should do justice to his enthusiasm and his keenness to know. And Vidya Shenoy ma'am is a very important person to the ARDSI, that is the Alzheimer's Related Dementia Society for India. She's a very active member. I have a student, Muskan, from Doon University. And all that you have spoken about, my MA and BA teaching, I have taught these subjects. As of now, I am teaching HR and OB to the industrial psychology students. And I am taking up economics and I'm teaching them general psychology. To start off about dementia, आप सबको पता होगा कि डिमेंशिया के बारे में बहुत कम लोगों को अवेयरनेस है. When I say बहुत कम, there is hardly a population in the country that understands what dementia is. अगर आप बोलते हैं मैम मुझे तो लगता है मैं चाबी भूल जाती हूँ, मैं मोबाइल भूल जाती हूँ, जाते जाते मैंने गैस बंद किया, right, this is also forgetfulness. But ये बहुत कम फ्रीक्वेंसी, कम इंटेंसिटी में होती है. Dementia on the larger picture is all about firstly forgetfulness and memory loss. I can forget, but if I do not have my memory, that is a problem. I can't remember my own self. This is a shock to my family that suddenly at the age of 70 I forgot everything. आप लोगों ने उरी देखा होगा जहां पे विकी कौशल की मदर को कुछ पता नहीं है, she has Alzheimer's, और वो एक दिन निकल के चली जाती है और उसके पीछे जीपीएस ट्रैकर, पूरी आर्मी, सब काम छोड़ के हम लोग उनके पीछे भागते हैं. These are very small and very important symptoms you all should know about dementia. Sir, can we start with the first slide, please? Please, sir. Very clear. It's very clear. Thank you. कोई बात नहीं सर, मैं वैसे विदाउट पीपीटी भी समझा सकती हूँ, नो इश्यूज. While sir is changing the PPT, never mind, I can continue. First and foremost, dementia is, आप लोगों, okay, please raise your hands when I say raise your hands. आप लोगों ने diabetes के बारे में सुना है? सुना है? Is diabetes a completely cured disease? Yes, no. Randomly say yes or no. Can I cure diabetes forever?
No,
हाँ जी
ma'am.
शालिनी बताइए. Good. No, exactly because diabetes is related to my hypertension and to my blood sugar levels, because of which there is excess of carbohydrates and glucose in my blood. Hence I cannot remove it from my blood. Sure, Vidya ma'am, we shall do that. Ji sir. Never mind, sir. I'll continue. So, like Shalini said, no, ma'am, diabetes is not curable, it is controllable. There's a difference between curing something and controlling. Now, for someone who has fever, paracetamol लिया, एंटीबायोटिक्स ले लिया, वायरल में आपने आप कोविड हुआ, बहुतों को कोविड हुआ, बहुत क्योर होके निकल गए. Curable disease, curable infection. Dementia, unfortunately, parts of dementia, and I'll tell you what dementia is. आप लोगों ने umbrella देखा है? You have an umbrella. An umbrella protects you. It protects you. It's a wide round circle of fiber that protects you from rain. So to understand dementia is like an umbrella. There are various diseases that make up dementias or dementia. There are various diseases like Lewy bodies, Huntington disease, there is Parkinson's disease, Alzheimer's disease, vascular dementia, frontal temporal dementia, various other dementias. These diseases are the cause of dementia. Some dementias, like I said, diabetes is not reversible. Hence, dementia, some dementias are not reversible. हम वापस जाके ठीक होके all my memory has come back. Does not happen. It does not happen. Why? Because there are two proteins. There are some proteins in the body and which are currently and completely related to our brain cells, our neurons. So what happens is that some proteins go in excess in the brain. In Alzheimer's disease, they are called the amyloids and the tau protein. These two proteins in excess block the neurons by creating plaque. Like teeth में आपने डेंटिस्ट सुने होगा, अरे आपको तो कैविटी होगी, प्लाक हो गया. Plaque stops your normal enamel from protecting you. The same way, जब ये two proteins आपके brain में चले जाते हैं, तब आपको protect करना बहुत मुश्किल हो जाता है. अब मैम आपने उरी के बारे में तो बात की, उसमें तो अल्जाइमर्स था, तो अल्जाइमर्स में तुम सब कुछ भूल गई. एग्जैक्टली. अब वो वापस रिवर्स में नहीं आ पाएंगी बिकॉज डिमेंशिया इज ए डीजेनरेटिव प्रोग्रेसिव डिसऑर्डर. डीजेनरेटिव प्रोग्रेसिव neurodegenerative progressive disorder in the brain. So when I say progressive, I am growing, I am multiplying, I'm getting faster into creating this walnut brain that we have to shrink it to its maximum. उसमें आपके सारे cognitive functions जिस पे मैं आऊंगी to explain मैम mental health होता क्या है, मैम cognitive functions होते क्या हैं. Remembering, reasoning, thinking, problem solving, creativity, conditioning, learning, perception are all brain functions that allow our brain to do different activities which are related to our central nervous system and the peripheral nervous system. ये cognitive functions में dementia इस part को ले लेता है. It takes it away. Sorry, you will not remember. Number one, dementia has taken my memory. Now, because I don't have my memory, what am I doing? I am so confused. I don't know what to do. That's dementia, Alzheimer's. I don't know what to do. क्योंकि मुझे याद नहीं कि मेरा नाम क्या था. मेरे सामने दो familiar faces हैं, लेकिन चलो होंगे वो कोई. Alzheimer's. Progressive, not curable, not controllable disease, not curable. तो आपने देखा होगा कि उरी में मैडम को वापस ले आए एंड एंड में जाके उनको सिर्फ इतना याद हुआ कि यस ये मेरा बेटा है. सो देयर आर फ्रीक्वेंट एपिसोड्स. थैंक यू सर. Brilliant. Can I just enlarge it for myself to read? Thank you. So I would like to start with the definition of dementia. Progressive dementia is an irreversible neurodegenerative disease leading to memory decline and debilitating physical and mental health. Debilitating, bringing me down. At the age of 65, Max, when I was with Max, like Sir rightly, Shalini Madam rightly said, ma'am was with Max. तो आते थे. मेरे फादर तो बिल्कुल ठीक थे, बिल्कुल ठीक थे. मैडम 35 ईयर सर्विस करी उन्होंने गवर्नमेंट में. अब जाके वो उठ के चले गए. लेफ्ट जाना तो राइट चले जाते हैं. फिर हमें खींच के वापस लाना पड़ता है. I understood where it was coming from. Now, unfortunately, autism is a neurodevelopmental disorder in children. It's not curable. Sorry to say, but autism and dementia are two psychotic organic brain disorders that are not curable. Yes, sir. It's very, very clear. Thank you, sir. Thank you. Abhi nahi change karenge, sir. So, like I said, autism and dementia are psychotic diseases, or psychosis is something that I am not aware of. मैं हवा में कासल बना रही हूँ, मैं कासल में रह रही हूँ, बहुत सुंदर हवेली बनाई, मैं जा रही हूँ, मेरे फ्रेंड्स आ रहे हैं, मैं उनके साथ रह रही हूँ. No, you are in your room. Where is the castle? Where is the haveli? Who are your friends? Psychosis. जब आपके organic brain, that is the brain functions, start debilitating, coming down, destroying, fading, degenerating, decaying gradually. और हमारी unreal beliefs, जिसमें hallucinations, delusions, illusions start arising. So onset of the disease starts at as early as 65. But let me tell you one thing. It is not necessary कि 65 साल पे मुझे dementia हो जाएगा. I could be 50 and it could be coming into me. I could be only 50. I am 5 years short of 50. Yes, sir, I will tell you. और मुझे एक sign और एक symptom चाहिए to understand that I have dementia. There are various types of dementia like Alzheimer's, dementia, AD. Most commonly known to many others are Parkinson's, vascular dementia. These are, like I said, various types of dementias. These are diseases. ये एक infection है, एक disease है, जिसके वजह से dementia बनती है. So, dementia is a progressive, degenerative, neurological, degenerative disease or disorder in your system. Sir, next slide, please. Thank you. Various types of symptoms. So important, people, that I have to tell you what symptoms are. आप लोग medical background के नहीं हो, so I'll tell you what a symptom is. There are two things in a symptom. एक है कि एक physical symptom, जो पेट दर्द हुआ, क्रैम्प, मड़ोड़ आया, कोविड में बुखार हुआ, आई फॉरगॉट वेयर आई एम गोइंग, कंफ्यूजन हो गया, फीवर हो गया, रेस्टलेसनेस हो गई, मुझे पता चल रहा है कि मेरी बॉडी पे कुछ आ रहा है. दोज आर कॉल्ड सिम्टम्स. SYMPTOMS, symptoms. Various types of symptoms that are found in dementia that are diagnosed are memory loss, poor judgment. हाँ जी, अब मुझे हो गया, अब पूरी में विकी कौशल की मदर को हो गया डिमेंशिया. Her daughter and her son have to constantly look after her. Constant. क्यों? क्योंकि A, memory loss. B, मैं नहीं जानती हूँ कि मैंने ब्रश किया कि कितने बार पेशेंट्स ऐसे वो बताते मेरी मम्मा को हमने खाना दिया, मम्मा बोलती है फिर से लाओ, नहीं खिलाया नहीं खिलाया, लाओ लाओ लाओ, पूरे दिन में 7 बार खाना खिलाते हैं. It's very unfortunate, people, but it is so sad to know that I don't know whether I've eaten my food or not. Thank you, Vidya ma'am. Sadisha, please don't worry. Everything is going brilliantly. I'm loving it. Speech problems. Both understanding and communication and language problems in reading and writing. Reading, writing तो आप भूल ही जाओ. क्योंकि memory में हमारी learning, retention, attention. Memory में retention, attention and learning are the 3 most important factors of memory. जब मेरे शॉर्ट टर्म मेमोरी और लॉन्ग टर्म मेमोरी में अटेंशन रिटेंशन नहीं हो रहा है, तो इट्स ऑब्वियस मेरी रीडिंग राइटिंग नहीं होगी, क्योंकि मेरे को सबसे पहले तो वर्ड्स नहीं फॉर्म हो रहे इन माय हेड. CAT कैट, अब बिल्ली दिखाई, मैं बोला बिल्ली क्या करती है, मियाओ. इसको क्या कहते हैं इंग्लिश में, आई डोंट नो. So this is a massive problem. Wandering, getting lost, trouble with daily activities like bathing. Now I'm coming to the more of the activity of daily living. ADLs are these are very non-medical psychological terms for our daily living activities. सुबह उठ के ब्रश किया, उठ के चली गई, मैं जा रही हूं अपनी फ्रेंड से मिलने, मैं आ जाऊंगी थोड़ी देर में. यू डिड नॉट ब्रश. नहीं, मैंने कर दिया, मैं जा रही हूं. कोई फ्रेंड नहीं थी, कोई नहीं जाना था, आप गुम हो गई. वॉन्डरिंग अवे इज वेरी फ्राइटनिंग, इट इज वेरी स्कैरी. केयर प्रोवाइडर्स या केयर गिवर्स जो ध्यान रखते हैं, चाहे स्पाउस हो, बेटा हो, बेटी हो, बहू हो, चाहे आपके नर्सेज हो, आपके अटेंडेंट्स हो, मेल्स हो, फीमेल्स हो, इन पे वॉन्डरिंग का खतरा है. I'll tell you why. My Masi, Meri Masi, who was a patient of Parkinson's for 40 years, she passed away because of Parkinson's. She was crippled. And there was a time once when she went out of the house. And I just told my mother, I said, Mama, Masi is going somewhere for a walk. So, what do you mean she's going for a walk? Bring her back. I didn't understand. I was in school, maybe in my 8th or 9th that time. I was like, okay, I'm bringing her. And I ran. I said, where are you going? I don't know. Oh my God. This sunk into me when I started working with patients with dementia. I said, Masi was going through all these these very scary events where she did not know what she was doing. From then, I promised myself that I was very late for my own Masi. I was very late to help people who I knew. But it's never too late to now do something for other people. They may not be related, but they are a part of your society. They are very important for you as much as your own family is. Understand, once you step into the periphery of dementia and you want to start curing people, you have to do a detailed study because it's confusing. You might do a MMSE or a very short diagnostic procedure. I'll tell you about that. But you may not be able to define what type of dementia it is till an MRI scan is not done, EEG, ECGs are not done, PET scans are not done, and proper neuropsychiatric assessments are not done. You will not know what your dementia type is. So Parkinson's में tremors होते हैं, एकदम से पाँव हिलेगा, you start shaking, your head will, you cannot control it. It's an involuntary muscle movement. आप इसको नहीं control कर सकते हो. Alzheimer's में आप भूल जाते हो. Alzheimer disease is very, very small in its brain structure to other types of dementias. एक normal brain और एक Alzheimer brain में वो सिकुड़ जाता है. It squeezes in. That is the plaque, that is these amyloid and the tau proteins are eating it up. तो वो छोटा होते जाता है. और obviously, जब आपके न्यूरॉन्स में स्पेसेस नहीं होंगे, आपके कॉग्निटिव फंक्शंस कैसे बढ़ेंगे? Cerebellum and cerebrum are the two biggest and smallest portions of your brain that hold your entire brain, which is hardly of any grams. वो उसमें ही shrink हो जाएगा, तो रहेगा क्या आपके brain में? And it is the life of your body. Your brain is your life. Okay. Most of the times, behavior of the persons. Okay, sorry. Wearing clothes, buttoning, button, unbutton. They can't. Pajama pehna ki nahi pehna, nikal pade. So many cases came to me at maths. So many of them. पापा ढंग के कपड़े नहीं पहनते, उठ के ऐसे ही चले जाते, because there is a problem. Understand that. Just suppose you have a throat ache and I'm saying, please scream and talk to me. Because of my throat ache, I can't scream. It's not that I don't want to. It's because I can't. From this side, come to this side of the person and understand where that person is. That's where care providers really need to be told and need to be given awareness. And if you all know anyone in your circle, Vidya ma'am is working in the periphery. She is within people with dementia and Alzheimer's. She's literally there with them. So she knows so much. I'll give ma'am a couple of minutes to be a part of my talk very, very soon. Most of the times, Behavior of the person is affected, leading to poor skills. आटा नहीं गूंद सकती, खाना नहीं बना सकती, मम्मी पैसे चुराती हैं. I know this is a very, very, very sad because she feels insecure, suspiciousness, hallucinations. Schizophrenia can be a very, very important and comorbid. Comorbid conditions are कि एक disease के साथ एक और जुड़ गया, unfortunately. Dementia के साथ schizophrenia भी हो गया. And schizophrenics, like I said, are psychotic cases. They cannot be practical. तो चोरी करेंगे कि भाई कोई मेरा पैसा ले जाएगा, चीजें को छुपाना शुरू कर देंगी, प्लास्टिक बैग्स के ढेर बन जाएंगे एक कमरे में, and you will not know. Yes, this happens. बैठे बैठे बातें करेंगे 1947, 1938. You weren't even there then. You lose track. You derail from reality. Most of the times, it's leading to poor skills and at times bad behavior like aggression and hitting the care provider. This is very, very difficult because aggression is a very important and I would say a very scary part. मारना, चीजों को फेंकना, आप पे डंडा जाएगा, पाउडर का डब्बा जाएगा, साबुन जाएगा, सब चीजें जाएंगी. They'll bite you or they'll bite themselves. They'll pull your hair. Yeah, care providers support is very important. That is my next topic. They are going through hell and more hell because they don't know what to do next. न्यूरोलॉजिस्ट ने तो दवाई दे दी, साइकियाट्रिस्ट ने दवाई दे दिया, लेकिन बिहेवियरल प्रॉब्लम्स जो साइकोलॉजिस्ट का पार्ट है, which is our part, that we can only do. So we have to understand firstly why aggression and bad behavior is coming. Because I don't think the care providers know that, okay, I used to really love basketball. And I look for something and I'm just bouncing. I'm doing this. The care provider is like, what are you doing? Why are you shaking heart? Seedha rakhe. Maybe there is some need. Tactile senses. Tactile. Okay, we've got 5 senses. Skin is one very important sense. So children with autism are constantly touching things because they need to have the feel of something that they want. So understand, dementia ka brain is there. There may be memory loss, but there are certain events, episodic or semantic. Episodic are there are events. I know I used to play basketball. I know I used to listen to songs from the 70s, rock music. I used to love heavy metal. Maybe the care provider doesn't know what at this point of time what the person needs. So aggression and hitting the caregivers may arise out of frustration and poor pain management. As arthritis, osteoporosis, and rheumatoid arthritis, rheumatism are very, very frequent health issues with old age. And they can't say, I'm in pain because I'm Alzheimer's. Alzheimer forgets. Hence, I don't know. And because I don't know, I can't tell you whether I'm in pain. And when I'm in pain, I am so irritated, get out of my face. पर care provider आप पे हावी हो जाएगा. नहीं जी, ठीक है. I went, this gentleman passed away. He was known to me. I'd gone for my research work and his wife was one of my subjects. And she told me, you have to see me, Dr. Neerja. I'm so positive with life. I'm so good at it. I'm taking care of him whole-handedly. I'm single-handedly doing it. When I looked from sar to paw, there were bruises. Unke paw pe zakham ban gaye the, zakham. That was not even looked at. What was the care provider doing? So they become like schizophrenics. They don't feel pain and sensation because they forget to relate to it. अगर आज मुझे अल्जाइमर्स है और मैंने ठोकर मार ली, ओके मारी होगी, वो इतना बड़ा ब्रूज बन के निकला है, केयर प्रोवाइडर स्क्रीमिंग, ये क्या हुआ? What will he say? Or what will she say? It is not only the person suffering, but the care provider and the family put together. And most likely the burden is on the spouse, who is either the wife or the husband of the children or the children. And on the other hand, it is the formal care providers, like institutions. So now I am coming to the most important part of my entire talk, is the one who is taking care. आपके घर में, जैसे one of my students I know, उनके घर में किसी एक elderly member को है और सब टूट पड़े हैं उन पर. Attention, stand at ease, attention, be on your guard constantly. There is no space for relaxation. You're constantly just, your life has just been revolving around that person endlessly. Ek din, do din, the person is 65. Yes, if it's not Alzheimer's, he can live up to a good 80, 82, 83 years. With Alzheimer's, if it's progressive and there are other comorbid conditions, then lifespan may be less. But even 15 years into 365 days, where is that care provider's happiness? That is when social support, sir, we can change. That is when I started thinking about, raising my voice to social support in care providers. Social support can be categorized in 4 types: perceived, emotional, instrumental, information, and received. Emotional support plays a vital role in the lives of care providers because I am frustrated. Like my children are happily married, they have their own children. I am a grandparent, but I am just constantly with my husband. If I have to go out, maybe I go out once in 6 months. Emotional burden sits here. They land up with vertigo, cervical spondylitis. They land up there, and the spouse may be of the same age. Wife or your husband or could be of the same age, or maybe 3 years or 4 years less. He or she might have old age health issues as well. So understand उन पे इमोशनल बर्डन्स कितनी तगड़ी होंगी, लेकिन वो चू नहीं करेंगी. क्यों? क्योंकि वो आपका हस्बैंड या आपकी वाइफ है और उनके लिए दुनिया जहान छोड़ दो. दैट इज सो इनकरेक्ट. दुनिया जहान नहीं छोड़नी है आपने सोशल सपोर्ट सिस्टम को तगड़ा करना है. अब बेटा बेटी को क्यों बताएं, सास बहू को क्यों बताएं. बहू तो बोलेगी मैम मम्मी मैं कब तक करूं, मैं तो नौकरी करूं. आई एम श्योर देयर आर सो मेनी सच केसेस. But then we have to find the right support system. The spouses who need to vent out their frustrations by seeking help and calling up their loved ones. Call, that was your father. For the son and the daughter, that was your father. That is your father-in-law, जिसकी शादी आपने पग फेरे करके घर के अंदर आए हो. घर के अंदर आए हो माने आपकी एक रिस्पॉन्सिबिलिटी जागृत होती है आपकी लाइफ में कि नहीं होती है. My father-in-law has neurological issues. He's sitting in the third room. He was on the ventilator. He came out. Not one day do I remember that I did not do what I was supposed to do. Where are your morals? Nihilism के बारे में किसी ने अभी मुझसे पूछा. Basically forgetting human values. Even if he's not, my father-in-law can walk, I still have to be a very felt last to last month. And I'm like, oh my God, that guilt is eating me today. I don't know how badly hurt he is. I really don't know how badly hurt he is. My grandfather, I forgot to tell you all. My grandfather, when I stepped into the house, pag fere karke main ghar ke andar aayi, he was 90. He passed away at 103. For those many years, my life was around him, circulating. This was my life. बाबा साहब ने खाया, बाबा साहब ने पिया, बाबा साहब ठीक है, बाथरूम हो गया, पॉटी हो गया, सुसु हो गया, नहा लिया, धो लिया, नहीं हुआ, कब हुआ, कैसे हुआ, all the time. That is when my interest just started piling up. And I wanted to go so deep into dementia. I don't remember, Dr. Satish sir, if I have not one day not done anything. I can't remember that. All marriages of my nieces, my nephews, my sisters-in-law, my brother, everything, one person of the house used to go, either my husband or my father-in-law. I was constantly at home, sir, constantly. And they're like, Bhabhi Saab, aate kyun nahi ho? I said, I have Baba Sahib. I'm sorry, the responsibility. Tomorrow something happens to him, that's a loss to my family. Even if he's 92, ghar ke sardar hai wo. He's the head. You can't forget that. Basic values, importance of giving the person credit who's given you so much. He's given us such a beautiful life. He's donated everything to us, and the least I could do is take care of him. So social support plays a very vital role in all our lives. Tomorrow, I have 3 daughters. I might need that. Even if I don't have Alzheimer's or dementia, I will still need them. Okay, to continue, sons or daughters who don't stay with the parents, friends, and cousins and visiting the relations. It can be the other way around and reach out to the care providers. That is what I'm trying to say. Let's reverse. Let us go to the care provider. Sir, the next slide, please. to reduce that emotional burden. You have to approach them. You may not know them. I have three of them in my locality in Dehradun and Dalan while I'm living here. And I have to go. I've forgotten I have to make a visit. She's a very dear friend. She's not my family, but I have a social responsibility. Informational social support means giving the care provider the right information pertaining to the kind of problems like proper medical treatment, be it mental or physical, and maybe to approach various NGOs or daycare centers. I should have done that for that lady, but I woke up and it was pandemic. अगर pandemic ना होता sir, मैं चली जाती मैम क्या, and I would have given her all the support, but I was so hesitant कि I'm asymptomatic and I'm carrying it. So pandemic has been a very big loss. I think Vidya ma'am, if you could just say yes, it's been a loss to dementia patients and care providers. Major loss. Even if I was not asymptomatic, my test was negative, that person may have had COVID. So either which ways, it was a threat to go to them. So 2 साल तो मेरे रिसर्च में बड़ा लॉस हुआ. That's all that I know. Treatment, but okay. Daycare centers and psychological clinics for now. Psychological clinics, memory clinics, India में नहीं होती. It's all America, Canada, US, New Zealand, Australia, Singapore have brilliant memory clinics where people with memory problems go, like Alzheimer's, dementias, learning disabilities, autism, all neurodegenerative developmental disorders in children and old age go to psychological clinics. Yes, ma'am, I see it as positive, ma'am. I agree over here. Positive in the sense that they were safeguarded at home, but ma'am, the care providers had such a loss. A, they had to take care of that person. B, there was no other help, no other support in the house. सब आपको अपने आप ही करना था. But on the flip side, let's be positive about it. As well as various other such institutions to discuss the problems. So people, अगर आपके known family में dementia के patients हैं, sir, we can go to the next slide. Let us go and approach them. Let us tell them. Let us guide them. Instrumental social support. Instrumental social support deals with giving aid like financial or monetary support to the care providers. Now, this is a question mark in this country because here it is, and I must say, it is very important that the government, if anyone is in the government sector over here and who's heard me, governments should financially aid because people, all respected people who are listening to me, हमारी finances की एक limit होती है in our old age. Our sons, daughters may not be able to fund us. And dementia, Alzheimer's, Parkinson, medication of neurological disorders is very heavy on our pockets. Very heavy in our wallets. Not everyone has that socio-economic status to be able to, pay for palliative care. I'll come to the stages of dementia. Pay for their monthly neurological tablets, pay for the psychological treatment, daycare centers. सबके pockets इतनी heavy नहीं होती हैं. They're all stratas of society in our country. The most elite can have a whole hospital in their home. But what about a poor person? What about a person who's just got maybe 20,000 as pension? Where will that person get any aid from? This is the most important amongst all supports for many families facing a financial crunch, may require some respite seeking help from the government, and lastly, receive support as well as belonging support. Now see, we have to understand it is very easy to ask for support. But when you receive the support, are you satisfied with the support? Are you content with the support? क्या आपको लगता है कि जो मुझे सोशल सपोर्ट मिला है, मेरी फ्रेंड्स आ रही हैं, मेरी भाभी आ गई, तो किसी दिन मेरे नेफ्यू आ गए, हमने राउंड्स में किए, तब भी आपको प्रॉब्लम है, मैडम एंड सर, देन यू नीड टू विजिट अ साइकोलॉजिस्ट. अगर आपको फाइनेंशियल एड आपके सन डॉटर इन लॉ भेज रहे हैं, डॉटर इन लॉ या डॉटर एंड सन इन लॉ भेज रहे हैं, yet you are dissatisfied, then you need to do a self-check on yourself. And lastly, receive support as well as belonging support, where both are equally important to the care providers and how they accept the support and feel wanted, satisfied, and cared by the society. That's exactly what I tried to say. Next slide, sir. Thank you. Yeah, this type of support is available when the care provider needs The social support system. Mostly in India, it's noticed that families are reluctant to accept, and it is not only further burdens the care provider with, and it only further burdens the care providers with excess mental baggage and emotional baggage. So my mother used to every year for a month, visit my Masi in Hyderabad. She would just take a flight and say, and I'd be like, Ma, where are you? Okay, I'm in Hyderabad with Masi. She did her bit. My Mamaji did his bit. My other Masi did her bit. Sometimes we would go, like, my sister went once to visit Masi. She did her bit. So receive social support is very important. ये हमको एक not a support literally. ये आपको थोड़ा सा let's deep breathe, let's relax, let's take it out. This phase is very important of taking the right support from whom, when, where, and how are important factors to take care of. Next slide, sir. Thank you so much. Next slide, sir. Activities for persons with dementia, the most important part. Now I have told you all so much about the symptoms. I've explained to you what the person goes through. Now comes that what can we do for that person? How does the person with dementia feel? I didn't say emotions मर गए. Emotions है ही नहीं. Dementia तो emotions गए. Emotions बरकरार हैं. It is within that person alive. He feels, she feels. They feel very strongly about the people around them. You switch on music, unke zamane ke Kishore Kumar, Mohammed Rafi, and you see there'll be a smile on the face. I can say it without knowing that person. Who knows whether the person with dementia, PWD's person with dementia, is angry or happy? Like I said, there may be something that that person wants. उनकी activities of daily living में ऐसी activities डालिए जो उनके past में होता था. Reading a book, can't read, you speak it out for them. Read it out. Newspaper, headlines. Good music. Maybe take a stroll in the park, but be careful. That person may have Alzheimer's, may have walking issues, may have rheumatoid arthritis. The wheelchair is available. Facilities are there. It totally depends कि हम उनको कैसे लें. What should I do with this person? You should do nothing. You should visit a psychologist or a geriatric psychologist or a gerontologist who work close, or daycare centers where people like ARDSI and their other institutes where they work very closely with the care providers. They literally train the care providers. You need to be trained. You may be trained as a wife, as a husband, but now your role has changed. You're not a wife. You are the provider. तो आपकी significant role अब बनती कि आप कैसे provide करोगे. मेडिकेशन के लिए दे दिया, आप न्यूरोलॉजिस्ट मैक्स हॉस्पिटल जाके आपने दिखा दिया, साइकियाट्रिस्ट की मेडिकेशन, उसके बावजूद भी और नो फार्माकोलॉजिकल psychological support, daycare center support. These are very common questions and worries about the persons with dementia, and one does feel strange when she has to face the person on daily basis for not one day but for a full life. We must understand that there are persons who were once loved, fought, cared for her family, but the only difference is now that she can't do so. So expect to try hard to remember whom she or he wants to love, fight, and care. So this is what I'm saying. You have to go. If you have a cough, you have to go to the doctor. It's the reverse. The doctor has to come to the person. The love has to come to the person. The care has to come to the person. You go to a daycare center and find out the kind of activities I can do, which we call a home-based program. देखो, dementia है, memory loss है, लेकिन brain dead नहीं है until unless you're in coma or a vegetative state. Palliative state माने आप बिस्तर पे लेट गए. That's your end stage of dementia. वो नहीं है. That means the brain can be stimulated. Work. Stimulation उसको massage दो, exercise दो, brain को, body को. In such cases, we have to introduce some activities that can help the person keep her cognitive functions stimulated. Mental stimulation is very important for people with neurodegenerative diseases. Sir, next slide, please. Psychological interventions are one way of helping the care provider understand how to effectively deal with the person. Play memory games. ताश के पैक्स लाइए आप. Go to a kid's store. Memory cards आती हैं. Apple, banana, flip. Now do one more thing. Get a basket of fake apples, like you've got fruits, plastic fruits, and then you've got the real fruits, and you've got the card. So the fake fruit, the real fruit, and the card. Breakfast time. What is this card? The person will point out if the stage is early to moderate stage 1 or phase 2, where recognition is possible. Recognition is possible. Because your memory just does not only mean memory, mane sab khatam ho gaya, bhool gaye. The person can still recognize, may not say the words, may not be good with semantics. Semantic means signs and symbols. So here we have to help them. So we do an activity, say, let's play a memory card game with real fruits and fake fruits. So now there is recognition of color, fruit, taste, smell. Senses aapke aa gaye sare. Auditory, visual, taste, smell, and skin, feel, touch. Go for a walk, keeping in mind, and you can do the same thing with other foods. Animals. You've got these apps for various sounds for animals. You've got the bird chirping, the cat meow, the dog bark, the cow moo. Remember, there's a life cycle. We did this as babies, with babies. Now we're doing it with an older baby. This is our life cycle. This is when we come with ignorance and we go with ignorance. A child does not know, child is taught. When you come into that childlike phase because of Alzheimer's and dementia, you've got to go back there. See, we are only doing this to keep the person going. We're not curing the person completely. We're just doing management. Keep a check on the medication and hygiene of that person. Involve the person in daily activities. So now lunchtime, okay. So lunchtime में दाल, तो हम दाल ले गए, राजमा छोले कटोरियों में ले गए. Feel करवाया. आज छोले बन रहे हैं. Which one is छोले? See, whatever it is, feeling is a very strong sense for anyone, even for me. I'm absolutely okay. But touch, the feeling of touch is very important. Perform all events and festivals as you did earlier. Diwali, lights, diya, Lakshmi Ma, Christmas, आपके बैसाखी हो गया, आपका होली हो गया, different colors. You got to stimulate the brain, like I said. Next slide, sir. Now, yes, I am going into reverse because I wanted to explain to you the part of dementia, and I'm breaking up dementia for you. Needs reminders. Daily routines are difficult. Okay, there is one term which I missed out. It's called mild cognitive impairment. MCI is the onset. Onset is कि कुछ शुरू होने वाला है. मौसम बदलने वाला है, बदल नहीं गया. It's the onset of monsoons. So here, mild cognitive impairment is the onset of any type of dementia. And remember one thing, if you've got a cardiac arrest, or if you've got a brain stroke, which is an ischemic stroke or a brain hemorrhage, you can be followed up with any type of dementia after that. That's just a good for your information bit. Daily routines are difficult, I can understand. Concentration is tough. Middle stage may need a hand to help. Initially, some dementias, मैं कर लूंगा, मैं कर लूंगी, मैं बाथरूम जाऊंगा. Middle stage, bathroom में मुझे ले जाओ. End stage, you are doing everything. May wander and get lost. Changes in personality. Fragmented personality. Broken up personality. Break me, and I'm all scattered. Because once I was this very charming, very dynamic person. Now I'm gone into bits and pieces. Severe confusion. That is, okay, the care provider gets more confused because you don't know the next symptom coming to me. Permanent care, constant care, not temporary, constant care. May not recognize anyone and may not perform any activities. मैं तो नहीं करूंगा, मैं तो नहीं करूंगा. घंटों तक बैठे रहो, वो करेंगे ही नहीं. Now it's your bit. You have to do it. So, if you know anyone who's in stage 3 or approaching, first and foremost, change the clothing style. Universal Designs, sir, Satish sir, और हम काम कर रहे हैं. And I would really want to say I am so blessed to be in touch with Satish sir. You have increased my enthusiasm and increased my perception towards dementia. Universal Designs, where I got it written with a friend of mine. We worked on spaces, how to create space for persons with physical disabilities. No, sir, I should do that to you today. Really. I've understood spaces after knowing so much about universal designs. So basically, अगर आपने बहुत सुंदर घर है और उसमें 10,000 चीजें रख ली, ठोकर खाएंगे, fall. Now, very important, people, listen to me before I forget this part also. Fall prevention. Because of dementia, there is an imbalance in the body and you have a chance of falling. आपने कुछ नहीं किया, आप गिर गए. आपने कुछ नहीं किया, आपको ठोकर लगी इतनी सी, क्योंकि न्यूरोलॉजिकल इंबैलेंस है, आप गिर गए. उस गिर के बाद आपका हिप फ्रैक्चर हो गया. फिर केयर प्रोवाइडर के लिए अनदर ड्यूटी. नाउ टू थिंग्स एडेड. वन इज ऑलरेडी डिमेंशिया एंड देन इज फॉल. माने कि व्हाई दैट पर्सन इज गोइंग थ्रू सो मच हेल. So keep spaces in your homes. Don't cluster your homes. For my father-in-law's room, I've removed everything. I make sure nothing comes in his way. Yet he fell. He slipped. Bathrooms. Bathrooms को fancy bathrooms, उसको rugged, very खरदरा bathrooms रखिए. Handles. Handles to hold. We have toilet roll handles. Keep bars. Bathroom bars आते हैं. For every step, a bar. For bathing, cubicle bar. For sitting on the pot, the Western style, a bar. To get up, to sit, to move, a bar. These are the arrangements we have to make with people who are getting older and more problematic. Because they can't perform activities, you have to perform it for them. It's very difficult, people. I can understand. If any of you have anyone with dementia, I can imagine what you all are going through. But you have to understand that we have to be smart. We have to be very smart in our techniques. It requires finances. Like I said, if the government can support dementia patients, if they know that there are homes जहाँ पे socio-economic status में आप economically weaker sector में आते हैं, आपको funds मिल सकते, तो आपका घर dementia free घर, like fall free, accident free homes, accident free malls, accident free roads, accident free shopping areas, parks. Because there is a normal population and then there is an abnormal. We are normal, but at times when it comes to abnormal, we need to have everything in the reverse, everything more cautious, more aware, more alert, vigilant. Next slide, sir. Person-centered care. It's all about the person with dementia. You have to keep yourself a little on the outer side. In between comes the person, all around it is the person. This person deserves respect. You can't treat that person like, listen, if you can't remember, it's not my fault. How many times do I do that? I know that's frustration speaking. But put the person first. You are dealing with a person who has no idea of who he is or what he can do. You have to be his extension. Extension cord lana zara. Nahi mara mera charger. Yes. We have to be that extension for them. Extended hand, extended leg, extended mind. Respect the individual as he, she was once your dear one. I have a daycare center 2 lanes away called Prem Dham. And people come in Toyota Innovas. It's no joke. I'm like, why? When you can come and deliver so much of goodies to your father or mother, why can't you keep your father or mother at home? I once asked myself, can I send my grandfather? No, I did just one question. And I was like, Neerja, how could you even think about it? एक आपके nihilism, somebody asked me, your basic values. The person might not live for a very long time. Just do what you can do for him or her. Promote positive healing and well-being. Promote positive healing. खुद को. Now you are the person. And remember one thing: the care providers have been given this very beautiful tagline: invisible second patients. We don't see your pain, we don't see your distress, we don't see your hurt. Lots of nice warm wishes coming to me. Thank you so much. But people, एक webinar से हम dementia को नहीं हटा सकते. It's a very big, it's a hurdle, it's an obstacle. We have to literally cross them. Thank you so much for your wishes, people. All action is meaningful. Everything you do, आपने इतना पुण्य का कमा लिया, आपने पुण्य का जो आपका मटका है ना, आप भरे जा रहे हो, और वो सब आपके बच्चों को लगेगा. Whatever I did for my grandfather, I'm doing for my father-in-law is all going to my daughters. All those values, they're subconsciously seeing a lot of things I do. They might even reciprocate to people they don't know. What if I see some abnormal behavior in the person? Report it. Don't think you can cure. Good afternoon, Dr. Rajesh, sir. Good to see you. Dr. Rajesh Bhatt, sir, is assistant professor of my university, and he's here. Thank you, sir, for coming. Right. So, sir, a lot has been said on dementia, sir. Oh, you missed it, but thank you for coming. What if I see some abnormal behavior? You can see abnormal behavior. You are not the doctor. Don't think that आपने कुछ देखा और आपने जादू टोना कर दिया और वो ठीक हो गया. No. Report it to your neurologist. Report it to your psychiatrist. Go to your psychologist saying that, listen, this person's just started throwing things at me. It was never there. आपको कभी कभी symptoms बिल्कुल एकदम से आएंगे और एकदम से जाएंगे, आपको नहीं पता चलेगा. तो आपने नोट डाउन करना है. In case you're forgetting, note it down. Day 1, day 2, day 3, day 10, day 15. After 20 days, something happened. Report all the behavioral symptoms that are abnormal and unique to you. Report to your psychiatrist, neurologist, and please keep these numbers with you. Your psychiatrist, your neurologist, your neurosurgeon, your psychologist, your daycare centers, your rehabilitation centers. These numbers, these places are very important. I'm not saying you're discarding. I am saying you're managing. Admit in a rehabilitation center, as I said, she comes before your need. See, I am not saying that Prem Dham jana galat hai. Maybe there are reasons, but your overall hard work matters the most. आप as a care provider क्या कर रहे हो, कितना कर रहे हो matters. Core psychological needs must be taken care of. What are your psychological needs? Emotions, your feeling, your thinking. These are your basic needs, and you have to, like I said, I've mentioned it in the first line, you are that extension. So imagine if that person fell, you should feel hurt. You should be like, ouch, I fell down. It's hurt me. I'm in pain. That's the pain the person has felt. So you have to feel that pain and run. Don't even think twice. Don't even think twice कि वोलिनी लगा देंगे, थोड़ा सा muscle relaxant खिला देंगे. No, it could be a ligament tear, a ligament rupture. It could be a fracture. You are not feeling the pain, mind you. For a good quality of life for both, there must be a cordial and cooperation relationship between the two. See, it's you working with you. It's the care provider versus the care provider. So as much as cooperation as the person with dementia has to give you, you have to cooperate 100 times more. That's very less cooperation that you're doing. With my grandfather-in-law, it was like I was constantly with us. Morning to night, I was with us. My father-in-law, my husband, maybe they didn't have the time. My father-in-law was away. So I was the person with the problem and the person being with the person. If you can understand where I'm coming from. Next slide, please. Thank you, sir. My advice to all the care providers, don't panic on any of the reactions. If the person misbehaves, you have to report it. I agree. It's your husband, it's your wife, it's your grandparent. I agree you're emotionally so tied up. But behaviors occur when there are chemical imbalances in the brain. ये आपके neurotransmitters होते हैं, आपके hormones होती हैं, dopamine, serotonin, epinephrine, norepinephrine, your secreting glands, your endocrine glands, hypothalamus, thalamus, they play a very important role in emotions. And something was really not liked. Like I did not like it, and I threw something went flying. Reported something went flying. Sir, what do I do? They will calm, give antipsychotics, antidepressants. They will give mood stabilizers, which are very, very important for persons with aggression in dementias. Keep stress at bay. Okay, report any of the person's behavior if it is not in your control. Keep stress at bay. Don't lose your cool and get frustrated as it's a long journey. Don't lose your head. मैं नहीं कर पा रही हो calling up your mother. I can't do this anymore. I am getting frustrated. Enough is enough in my life. No, but that person is still living, na? You got to be there. Have faith as this too shall pass. It's your loved one in the situation, so be calm and relaxed. That person also loved you at one point of time. That person was your father. आपके पोटी सुसु में, आपके पैम्पर बदलने में, आपकी उल्टियों में, खांसी, जुकाम, fever, virals, flus, allergies, maybe surgeries may he played a vital role in your life. Today you have to give it back. There's something known as return, gratitude, protocols. You've got to do that protocol. You can't ignore it. Today, if something goes wrong, my father-in-law, 18 years back, I got everything that I wanted. Today, if he wants something, I better be there to give it. That's the least I can do as a bahu. I can't financially fund him. He's richer than I am, but I can morally, emotionally, psychologically, socially support him. That's the least I can do. Sir, I think that's the last slide. Maybe there's one more slide, sir. I don't remember. Thank you. My sincere thank you to you, Dr. Satish Sharma. Oh, sorry, Chandra, sir. Sorry, I tried to change it. It didn't change. And team. I am humbled and privileged to be a part of this webinar. Care providers are the invisible patients who need all our love and support. Thank you so much. Thank you.
You need to ask some questions.
Yes. जी सर उसमें गलती हो गई सॉरी सर सॉरी माय फॉल्ट सर राइट मेडिकल फीवर जब आपको लग रहा है मे बी more than 5 to 10 times you see symptoms of confusion, memory loss, misbehavior. सबसे पहले आपने न्यूरोलॉजिस्ट के पास जाना है. Neurologists are those who will treat you for the imbalance or the disease that is present in the brain. The psychiatrist will be the person who will teach the brain the behavior of the person which is abnormal, and the psychologist will do a very quick diagnostic procedure called MMSE, mini mental examination. That is just a quick check to see whether there is any cognitive impairment, mane any cognitive loss. So these three people will do your treatment. If you need to go for an MRI, if you see tremors, like I said, Parkinson's में tremor होता है, confusion होता है, lack of self confidence होता है, आप shake कर रहे हो, आप हिल रहे हो, आपसे control नहीं हो रहा है, you have to go for a CT scan, MRI. Alzheimer's हो गया, suddenly you walked out of the house and after 5 days you come back, there is a big problem. Alzheimer's. If any of the symptoms जो आपने मेरे PPT में पढ़ा है, वो श्योर शॉट आपको डॉक्टर के पास जाना है. Even if there is 5 symptoms out of them, memory loss, confusion, not being able to speak properly, speech problems, communication issues, behavioral problems, cannot decide well, cannot function well, forgetfulness, memory problem, forgetfulness. You do not know whether you've eaten or not eaten. 5 times, 10 times, you're looking for something. It is sitting on your head, your chashmas on your head. So these are the very, very small problems. Inko sabse bada banayenge. And go to a doctor. Neurologist says, okay, it's just anxiety. Okay, but then if you see this is again coming up a lot of time, then you need to really look into it. What really triggers, sorry, can I just read the question? What really triggers this neurodegeneration? Is it related to lifestyle management? Superb question, Tanya madam. Yes. Let me throw a little bit of light on people with dementia. Number one, I said it is excessive protein in the brain. The tau protein, Tanya ma'am, and the amyloids. These are two proteins that go excessively into the neurons. तो वो ना आपकी जैसे मेरा ग्रूव बना है इसके अंदर चला जाएगा तो आपके न्यूरॉन्स की जो सिग्नलिंग होगी जो साइनेप्टिक एक साइनेप्स आता है उसमें सिग्नल्स नहीं पहुंचेंगी तो दैट विल ब्लॉक द पर्सन फ्रॉम रिमेम्बरिंग थिंकिंग रीजनिंग प्रॉब्लम सॉल्विंग so these amyloids and proteins need to be taken down. They're called reputates. So इनकी medications अलग होती है मैम. And like I said, for autism and dementia, genetic is one. Lifestyle could be two. Severe depression, brain trauma, brain injuries, cardiac arrest, brain stroke, cardiac stroke, infarct or clots in the brain could lead to dementia. Yes, sir. Yes, sir. Yes, sir.
Uh, first of all, thank you, madam. Myself, Pankaj Pandey from Varanasi.
जी सर.
मेरे फादर और मदर दोनों ही साइकेट्रिक हैं और
Okay.
फादर का तो एपिसोडिक होते रहता है 14 से. इस समय वो निहिलिज्म फेस कर रहे हैं. इसके पहले उन्हें बाइपोलर था, उसके पहले डिमेंशिया था, वो सब तो रिकवर्ड हुए. उसके बाद डिलीरियम हुआ.
Delirium.
तो
Okay.
सिचुएशन तो हैंडल हो जा रहा है, लेकिन हमें ये समझना है कि बिसाइड मेडिकल और उनको हम क्या कर सकते हैं. जैसे डाइट है उसको हम मेंटेन करते हैं, बिहेवियर वाइज उनके लिए हम क्या कर सकते हैं. और फॉरमोस्ट वो इफेक्ट खुद को ना हो, क्या है कि उनकी एनर्जी इफेक्ट करती है हमें, उसको कैसे बचें. उनके जो
Right.
निगेटिव एनर्जी है उनसे कैसे प्रोटेक्ट कर पाए खुद को.
Sir, two very important points you put in front of me. Just shut the door, please. First and foremost, आपने ये बोला कि he's been diagnosed as bipolar disorder, right, sir? Secondly, आपने बोला कि dementia, या आपने dementia बोला. Thirdly, आपने बोला कि negative remarks आ जाते हैं, negative behavior आ जाता है. First and foremost, sir, how is the medication going?
मेडिकेशन ठीक है, बनारस के एक अच्छे डॉक्टर हैं, डॉक्टर जहर, वो देख रहे हैं.
Jane. Okay, he's a psychiatrist. Okay, like I told you, sir, like I really mentioned a little time back, कि bipolar disorder, schizophrenia are psychotic disorders, sir. इसमें क्या होता है कि वो आपको आपकी उनकी reality सबसे पहले लाएंगे. Do you understand me? उनकी reality आगे आएगी. बाकियों की reality पर उनको कोई issue नहीं है. First and foremost, sir, the medication treatment has to be in a good line. That is called the first line of treatment. अगर medication के बाद भी behavioral issues हो रहे हैं, तो psychological therapies काम नहीं करेंगी. सबसे पहले कि उनके medication या तो change हो, क्योंकि उसमें आप और negative symptoms देख रहे हो. Means somewhere down the line, the medication is not in alignment to the concerning problem. Go for a re-diagnostic करिए उनकी. Because bipolar disorder
मतलब second
manic
opinion.
depressive disorders होते हैं. Morning he'll be very okay, night he'll be very high. Morning he'll be very quiet, evening he'll be very loud. ये extremists हो जाएंगे, left extreme, right extreme. और इसके बीच में
I can
आपको
understand.
issues होंगी. So bipolar disorder, there's a cyclic, it's a cyclic disorder, or it is manic, or it is depressive. So you have to literally get it diagnosed again, sir. Then therapies में होती है कि is he okay to talk to you? Can he talk? Sir, Pankaj sir, does he talk to you? वो बात
Yes,
करते हैं आपसे?
yes.
Then you can. जी.
He is fantastic, लेकिन क्या है कि he is not cooperating. In the sense कहता है कि अब खाना देना है तो खाएंगे नहीं, दवा लेना है तो रिजेक्ट करेंगे, और
I agree.
अपनी दिनचर्या है कि नहाना है तो.
Sir, so
अब
in
क्या है
this
कि इसका
case,
साइड इफेक्ट हो जाता है.
yes, sir. मेडिकेशन के साइड इफेक्ट्स होंगे सर। वहां पे आपके वाराणसी में साइकोलॉजिस्ट हैं सर? तो सर एक
है,
सेशन
बीएचयू है।
साइकोथेरेपी का लेवा दीजिए उनको, गिव हिम 1 सेशन ऑफ साइकोथेरेपी सर।
ठीक है।
कॉग्निटिव बिहेवियरल थेरेपी करवाइए आप, इफ रिक्वायर्ड टॉक थेरेपी करवाइए। यू हैव टू गेट डाउन टू द रूट कॉज सर, यू हैव टू गो डाउन टू द रूट कॉज। आप बीच में अगर किसी बस को पकड़ोगे तो आपको लगेगी, तो इससे अच्छा है कि पहले मैं देखूं कि बस रुक रही है कि नहीं रुक रही है। We have to go to whether the bus is going to stop for me. So I have to go way back to all the problems. आपने ये behavioral changes कब देखे? कोई ऐसा event हुआ जिसमें उनकी problems आपको दिखी? That event may have
2014
triggered.
से।
Right, sir. So you will have to go back to go refresh yourself way behind. दोबारा उनके सारे मेडिकल्स निकालिए। अगर आप चाहते तो मेरा व्हाट्सएप नंबर है, आप मुझे डायग्नोसिस व्हाट्सएप कर दीजिए एंड देन मे बी आई कैन हेल्प यू आउट फ्रॉम योर सर।
नंबर हमने भेजा भी है आपके डिटेल के लिए, तो वो मेरा ईमेल है, वहाँ वो उस पर आ जाएगा। दूसरा एक चीज समझना ये है क्या?
हाँ जी सर, जी सर,
ठीक है
जी पंकज सर।
एक चीज एक समझना था मैडम कि जैसे साइकेट्रिक पेशेंट के साथ रहने पे जो
जी
अटेंडेंट है
सर,
उस पे
जी
उनकी एनर्जी और उनके बिहेवियर का इफेक्ट होता है। नो डाउट हम भी एग्रेसिव हो
होता है
जाते हैं,
सर,
नेगेटिव
आई
हो
एग्री।
जाते हैं,
जी सर,
बेचैनी,
जी।
उससे कैसे बचा जाए?
ओके सर, 2 थिंग्स सर। फर्स्ट एंड फॉरमोस्ट आपने ये समझना है दैट दिस इज अ क्रॉनिक प्रॉब्लम आई हैव टू डील विद। मैंने एंड में क्या लिखा था अपनी पीपीटी स्लाइड पे? योर पॉजिटिविटी एंड योर वेल बीइंग कम्स फर्स्ट सर। अगर आप पॉजिटिव एटीट्यूड नहीं रखोगे, उनकी नेगेटिविटी आपको दबाती रहेगी। एंड वन मोर थिंग सर, I would really like to make this clear. There's something known as pseudo behavior. He is at times just doing it to either gain more attention from you, distract you all. वो आपसे बचना चाहते हैं, वो बदमाशी कर रहे हैं, वो बचना चाहते हैं, वो तंग करना चाहते हैं। You have to start ignoring it और आपको काउंटर अटैक नहीं करना है, आपको आवाज नहीं रेस करनी है। आपने कई बैड बिहेवियर को, जैसे बच्चों के से बदमाशी को इग्नोर करना है और ऐसा दिखाना है कि इट इज नॉट अफेक्टिंग मी एनी मोर। धीरे धीरे करके उनकी बिहेवियर कंट्रोल में आएगी। Understand sir, there is a
यस
problem.
सर,
उस problem, yes, so you have to be very very strong। माने कि बिल्कुल दिल पे पत्थर लगा के चलो इस बात को लेकर,
थोड़ा
दिल पे
डिफिकल्ट होता है,
पत्थर।
बस
Don't
प्रैक्टिस
get
करेंगे।
emotional, don't get emotional, it is your father। I respect you wholeheartedly but do not get emotional। Emotions will eat you up sir। Be strong, face it। Your first and foremost thing is that you have to face it।
दूसरा कि ये सेशन अगर यूट्यूब पे अपलोड हो सकता है
जी
तो इस
सर,
पर भी हम लोग को और भी फायदा हो जाएगा। और ग्रुप ठीक है। जरूर सर, जरूर सर। थैंक यू सर, थैंक यू वेरी मच।
अंजू मैम को कुछ पूछना है? यस मैम।
Yeah, ma'am. Thank you so much. This wonderful session, and it's very like बहुत सारी चीजें थी जो clear हुई मुझे भी as a psychologist। I'm a psychologist, but I feel जो आज का topic था वो मेरी family से सीधे direct connect हो रहा था। Actually, my mother-in-law is like ये वाली प्रॉब्लम उनको है, न्यूरोलॉजिकल और भी बहुत सारे इश्यूज हैं। मेरा जो अभी पांडे सर ने क्वेश्चन किया कि हमारी जो खुद की वेलबींग है वो इफेक्ट होती है।
राइट राइट राइट।
और कहीं ना कहीं मेरी एज अ साइकोलॉजिस्ट आई डील ऑल दिस थिंग्स, बट कहीं ना कहीं 1% मेरी भी वो साइकोलॉजी जो वेलबींग है वो इफेक्ट हो रही है। बट मेरा क्वेश्चन यहाँ पर ये है, आई डू 100% विद माई मदर इन लॉ कि मुझे ये करना है, ऐसे करना है, सारी चीजें अपने तरफ से बहुत अच्छे से कर रही हूँ और बाकी भी जो सराउंडिंग में है वो भी बहुत अच्छे से इस चीज को फील भी करते हैं और समझते भी हैं। बट एक क्वेश्चन यहाँ पर ये आता है कि मैम जो रिलेटिव्स है,
जी,
रिलेटिव्स हैं, जैसे once a week, one a month, कभी ना कभी वो आ ही जाते हैं, आ जाते हैं उनसे मिलने के लिए, लेकिन कहीं ना कहीं वो जो एक नेगेटिव होता है, मतलब लाइक आप तो अच्छे से कर रहे हो, आप समझ भी रहे हो और जो पेशेंट है वो भी समझ रहा है, बट जो ये सराउंडिंग वाली चीज है ये कहीं ना कहीं मेरे को ट्रिगर कर रही है कि मैं 100% दे रही हूँ और मैं सारी चीजें समझते हुए सब अच्छे से कर रही हूँ, लेकिन फिर भी कोई ना कोई ऐसा पॉइंट हर मंथ, मैं आपसे ये चीज शेयर करूंगी क्योंकि मेरी फैमिली का इशू है कि हर मंथ कोई इस चीज को लेके, कोई एक पॉइंट को लेके एक बड़ा ड्रामा क्रिएट हो जाता है। ये हर मंथ का इशू है मेरे साथ। सो कैन यू सजेस्ट समथिंग कि आई ट्राई, मतलब मैं कितना कर सकती हूँ उससे कहीं ज्यादा मुझे ऐसा लगता है कि मैं कर रही हूँ, बट ऐसा कहीं मैं हेल्पलेस हो जाती हूँ।
आपने ये बात सुनी होगी, शादी में जाके, शादी में जो खाते हैं घराती बराती 10 नुक्स निकालते हैं शादी में, ये नहीं हुआ, वो नहीं हुआ, खाना ऐसा था, पंडित ऐसा था, रिचुअल वैसा था। शादी हो गई, पति पत्नी बन गए, उनकी एक लाइफ हो गई, दैट इज योर लाइफ. It's just you and you, man, with your mother, your husband, your father, your children. That is your first family. Society will take out issues, they will try to put you down, but your strength, your confidence should be up and motivated always, man. लोग दबाएंगे, दबाने के लिए दुनिया खड़ी है. Be very strong.
Thank you, ma'am. Thank you so much.
You're welcome.
मैम आप सभी का बहुत बहुत आभार, बहुत ही अच्छा सेशन रहा मैम.
Thank you, sir.
अंजू मैम सुन रहे हैं क्या हमें?
हाँ जी सर, जी सर.
जी सर, सवाल मेरा कोई नहीं, बहुत ही अच्छा सेशन लगा, इसके लिए आप सभी का बहुत बहुत आभार, धन्यवाद.
थैंक यू सर.
और सर ये कह रहे हैं अगर कभी रिसर्च पे या रिसर्च मेथोडोलॉजी या सैम्पलिंग पे कोई अगर वेबिनार हो तो थोड़ा अवगत करा दीजिएगा. करंटली मैं दिल्ली विश्वविद्यालय से PhD कर रहा हूँ सर.